today I'm going to explain about what is HIV or AIDS. So HIV is the virus that causes the sexual contact, such as sharing needles for illegal drugs or injections, coming into contact with infected blood, or transmission from mother to child during pregnancy, childbirth, or breastfeeding are always that HIV might spread. So white blood cells, called CD4 T cells, which are crucial to your body's ability to fight infection, are destroyed by HIV. As in for AIDS, those who share equipment and engage in unprotected sex with a drug-injecting partner, those who exchange sex toys with an HIV-positive person, individuals who have a history of hepatitis B or C, or sexually transmitted illnesses. So individuals with a history of several sexual partners. So as you can see, as in the table shown, there are differences between the HIV and AIDS. So as in HIV, the virus that invades the immunity system itself, while AIDS is the last stage of a spectrum conditions where initially caused by the infection of HIV. So for HIV, patients will suffer minor difficulties such as the symptoms more likely like flu, and while as in AIDS, the patients will experience severe signs of symptoms such as disrupting the quality of life. So I think that is all for my presentation. Thank you.
Okay, before we go further, there are fun facts about HIV or AIDS in Malaysia. In Malaysia, the first cases of HIV or AIDS were reportedly known in 1986. Since then, the number of HIV infections in the nation has increased to over 100,000, and as of December 2013, more than 16,000 individuals had passed away from AIDS. Now we go for number 2, which is who causes HIV or AIDS. The person who causes HIV or AIDS, which is such as the sex workers, transgender people, injecting drug users, and the men who have sex with men, are the communities that most affected by the epidemic in this nation. Since the first incidence was discovered 27 years ago, Malaysia has had an estimated 81,900 persons living with HIV, which is PLHIV, as the end of the year 2012. According to the 3,393 new HIV infections that were reportedly in 2013, almost 10 Malaysians contract the virus every day.
Hi, Assalamualaikum warahmatullahi wabarakatuh. I am Muhammad Wafi Akil and I will present about when will HIV or AIDS occur. Both HIV and AIDS can infect a healthy person by transmission, either skin contact or trachea path. Therefore, here are some examples how HIV and AIDS can be transmitted. The first one is having a sexual intercourse without protection. For example, during sexual intercourse, when the men do not use condom, the sperm will enter the vagina. The second one is food contamination. Sharing cutleries that have been contaminated by the saliva of HIV patient can make a healthy person infected by the HIV. And the last one is medical care. When a healthy person share injecting equipment that have been contaminated with the blood from the HIV patient can make the healthy person infected by the HIV. Next, I will present about how to reduce the risk of getting HIV and AIDS. The first one is, for couples, go for sexually transmitted disease test or STD test before getting married. Next, use only sterile needles or injection equipment. And the last one is avoid high-risk sexual behavior such as oral sex or anal sex. That's all from me. Thank you.
Hi, Assalamualaikum. My name is Nur Rahna binti Karudin. So the next is why does HIV and or AIDS education is important. At first, it will help us to indicate about HIV transmission. This is how we giving people information about HIV, which is what is HIV and AIDS are, how they are transmitted, and how people can protect themselves from infection. And next is we can improve quality of life for HIV positive people. As we know, AIDS education is seen as being something which should be targeted only at people who are not infected with HIV in order to prevent them from becoming infected. So when AIDS education with HIV positive people is considered at all, it is frequently seen only in terms of preventing new infection or by teaching HIV positive people about the importance of not passing on the virus. Okay, so next, it will help to reduce stigma and discrimination. In many countries, there is a great deal of fear and stigmatization of people who are HIV positives. So this fear is too often accompanied by ignorance, resentment, and ultimately anger. Discrimination against positive people can help the AIDS epidemic to spread. So if people are fearful of being tested for HIV, then they are more likely to pass the infection to someone else without knowing. So that's all.
Hi, my name is Maisara Az-Zahra binti Yaqub. Now let's move on to the last question. How does HIV or AIDS occur? Well, to become infected by HIV, infected blood, semen, or vaginal secretions must enter your body. This can happen in several ways. The first one is by having sex. You may become infected if you have vaginal, anal, or oral sex with an infected partner whose blood, semen, or vaginal secretions enter your body. The virus can enter your body through mouth sores or small tears that sometimes develop in the rectum or vagina during sexual activity. The next one is by sharing needles. Sharing contaminated injection drug paraphernalia such as needles and syringes puts you at high risk of HIV and other infectious diseases such as hepatitis. The last one is during pregnancy or delivery or through breastfeeding. Infected mothers can pass the HIV virus on to their babies. Mothers who are HIV positive and get treatment for the infection during pregnancy can significantly lower the risk to their babies. That's all from us. Thank you for lending your ears.